Okay, folks, here we go. I'm going to talk you through this PowerPoint. It's going to be done in two parts. So we'll talk about mainly the thigh in part one. That's what you'll do today. That's Thursday. And then tomorrow on Friday, you guys will do, you'll watch another video. You'll do the groin and hip injuries, and you'll also have a quiz over that diagram. So don't forget to study for that tonight. I'm going to go through, and on each slide, it tells you what number you need to answer on your unit plan. You are not turning that in right now. You will turn it in next week, but you're not turning that in right now. And then occasionally throughout, I will ask you questions. You just got to make sure you're listening to me, and then write down the answers to those questions on a piece of paper, and you'll turn that into the substitute before the end of the class period. So here we go. This is number 2 on your unit plan. It talks about prevention of thigh injuries, and the thigh needs 3 things: maximum strength, maximum endurance, and maximum extensibility in order to withstand a strain. So that's what we do in the weight room, right? We do strength, we do lower reps, we do endurance, we do higher reps, and then we do extensibility, so flexibility stuff in order to withstand the strains. Dynamic stretching is good. We've talked about that. And then strengthening programs also, and you can see there's some examples of some things that we do in the weight room. If at any point you feel that you need to pause, then go right ahead and do that. The first question that I have for you to write down the answer to is I need you to list an activity that you do in the weight room that strengthens your thigh. An activity you do in the weight room that strengthens your thigh. Okay. Next, this is number 15, and I apologize, we jump around a little bit here on the unit plan, but we need to make sure we understand the bony anatomy. So the femur, it's a big bone, right? We've talked about that. Its main goal is to support your body weight. And then the pelvis, it connects the trunk to the legs, and it also supports the trunk. So it's kind of like that connecting piece, but it also is very important for support. Numbers 20 and 25. This answers the question, these questions. So the innominate bones of the pelvis, so like unnamed, because they're all kind of one in the pelvis, are the ilium, the ischium, and the pubis. And hopefully you understand that as we have already done the diagram. Once again, you'll have a quiz on that tomorrow. Okay. Little bit of assessment here. It's pretty basic stuff, right? So when did it start happening? Make sure they describe the pain, any observations that you might have. And you guys did a good job with your special test, so I'm not going to go into too much detail on this. Making sure you do your palpations, obviously. And then the special test that you guys took care of. You can delete number 1 on your unit plan. It says list and briefly describe the special test. You guys did a video on that instead. Okay, we're going to jump into the injuries now. You should have an injury chart at the bottom, so this is going to be a little challenging. You're going to go back and forth between the injury chart and the unit plan, and then sometimes you might have to answer questions on that piece of paper. So it might be a little challenging, but I know you guys are up for it. I apologize, I'm yawning. All right, so number 16, first injury here is a quad contusion. This is just a bruise to the quad. We've talked about that. Its cause is that you constantly get exposed to traumatic blows. These are painful. You might have a little bit of loss of function, and then immediate bleeding of affected muscles. Now, the blood's not going to be pouring out of your skin here, but it will start to look like it's bruising and turn a little bit red. This is really important that you have early detection of it, so that we don't get scarring in that muscle, or maybe even myositis ossificans when we're going through this. Then here you can see a picture here of a quad contusion. I believe even looked at this when we were looking at the knee. So what do you do for it? Well, you got to rice it and take some NSAIDs. If it's really bad, they might give you crutches. Isometric quad contractions should begin as soon as they can. So your second question that I need you to write on your piece of paper is I need you to define isometric. Define isometric. If all you can remember are the ways that we practiced it, that's okay, but I need you to define isometric. Give me something that tells me that I know you know what isometric means. Then you can also do heat, massage, ultrasound to prevent myositis ossificans from happening. Remember, myositis ossificans, sorry about the dog. Myositis ossificans is the buildup of calcium. And you can also wear a pad on it if you need to when they get back. All right, here is myositis ossificans. It's the formation of ectopic bone following repeated blunt trauma. Repeated, so running back gets hit over and over again. Other football players, wrestlers, people that just get hit, nailed in the same spot. The signs of injury, the x-ray is going to show that calcium has been deposited about 2 to 6 weeks following when they recall the injury happening. They're going to be in pain, they'll be weak, swelling, some decreased range of motion, and some point tenderness. And with treatment, you've got to be really careful with this. You can't try to rush them back. The treatment needs to be conservative. So it may require surgical removal if it's too painful and restricts the motion. You've got to wait a year though, because if you remove it too early, it may come back. If it's something that happens over and over again, then they might be concerned about blood clotting, but for the most part, that's not the case. So there's some myositis ossificans images. This is a quad muscle strain. And so on the next slide, we'll talk a little bit about the different types of tears. This is actually the most common thigh injury in sports, is a quad strain. And so basically there's a few ways you can do it. You can get a sudden stretch, or when an athlete falls on a bent knee, or experiences a sudden contraction. So anything fast. So what I want you to write for number 3 is a possible scenario when someone could tear their quad or strain their quad. So come up with that. If you need to pause, and then we'll move on. Signs of injury. A peripheral tear, which means along the outer edges, is going to cause fewer symptoms than a deeper tear. There'll be pain, point tenderness, spasm, loss of function. A complete tear actually may leave the athlete with little disability and discomfort, but it'll be deformed. And I'll show you a slide on this on the next couple slides here. And then what do you do for it? Well, you got to rest it and ice it and really compress it early. And then you don't want to stretch it early. Rest, ice, compress it early. And then you can maybe move on to some more stretching and range of motion stuff after you get the initial swelling taken care of. Here you can see the divot in this person's leg. That's a quad strain. Okay, that's a tear of the quad. Remember, strains are just little tears or big tears. And you can see the dip here. Okay, that's a pretty obvious one. So here are the 3 types. This is very similar to all the other types of strains and sprains we've talked about. Grade 1 is tight. They'll still be able to walk though, and they'll just have mild discomfort. And then grade 2, a little bit more trouble, noticeable swelling. And then grade 3, they can't walk. There's a noticeable defect and severe pain. And then you can see here that in a grade 3, it's completely ruptured. So grade 1 is just a pull, grade 2 is a partial tear, and then a grade 3. And you can see here the treatment varies based on the different ones. So make sure you're pausing and filling out that injury chart as we go through. I really think it's important that you guys do that for your understanding and your retention. Remember that the quad muscles extend the knee, so knee extension will also be affected if you damage your quad. Hamstring muscle strains. There's multiple theories as to why we strain our hamstrings. One is that the hamstring and the quad contract together, and the quad is typically stronger, so that ends up in a hamstring strain. The change in role as the hamstring goes from a hip extender to a knee flexor, there's one theory there. And then a lot of things, leg length discrepancies, lack of flexibility, fatigue, lots of different theories. Either way, the signs of it, you're going to have pain. So either where it attaches up by your butt or down by your knee, or in the belly of it, so right in the middle of your leg. Pain, loss of function. Grade 1, you're going to be sore. Okay, point tender. Grade 2, you might have felt a sharp snap or a tear, and severe pain, and a loss of function. And then grade 3, this is when it actually ruptures, and there's a lot of bleeding, a lot of swelling. There may even be like a palpable mass. Same thing, you don't want to do stretching right away. You just want to rice until that thing really starts to feel better. And then there's that palpable mass that you can see, guys. It just tears, kind of balls up. So that's a strain or torn hamstring. Then there's another one with some bruising on it. You can see the bruising goes all the way down here. And another one where it has balled up right there. Some more bruising on the back of the leg. All right, acute femoral fractures. This is the answer to 4 questions, so make sure you take your time on this. If you need to pause, pause. Generally, with femur fractures, it involves the shaft, and it requires a great force to break these, guys. These are not easy bones to break. Usually it occurs in the middle third of the bone. Signs of injury. The person will probably go into shock. This is very difficult to break, and so they'll probably be in shock. They'll be in a lot of pain. There'll be swelling, might even be some deformity. You've got to be aware of if that bone is displaced. So is it moving? Is it sticking out of the skin at all? And then loss of function. And the very first thing you got to do, because this is a medical emergency because of the shock. You got to treat for the shock. You got to verify that their nerves and their vessels are still moving, and then you got to splint them prior to moving them. And then you're going to want to call 911 for somebody with a fractured femur. Here are some images. You can see this one just broke straight across. This one's more of a spiral fracture right here. Here's your next question. Write down 2 other types of fractures. I just mentioned 2, transverse and spiral. Write down 2 other types of fractures that you remember. Femoral stress fractures. These are really uncommon because you're, well, number 5, you tell me why you think these are so uncommon. They are. They tend to occur in endurance athletes, and they occur in females more than males. Signs of injury. The pain occurs weeks after increasing your workout intensity. So you start to work out more intensely, and the injury happens like a few weeks after that. You have this persistent pain in your thigh and in your groin, especially after activity. Sometimes it even refers down to your knee. You've got to have an x-ray or a bone scan to reveal the fracture, and a lot of times we see them in the femoral neck, which would explain why the pain is in your groin, because that neck is up in your groin. Management, you got to rest, and while most headed off with with conservative management, a fracture may result, and if that happens, then you're going to have to go in and surgically repair it. So here are some images of some femoral stress fractures. You can see just a little bit on the x-ray here where they're built up. Okay, so the groin strain is where I will pick up tomorrow with tomorrow's video. So for today, you have 5 questions you needed to answer. Make sure you got those. If you did not, then you need to go back and watch again and listen for the 5 questions. Don't forget you have your quiz tomorrow, and then we will do part 2 of this video tomorrow as well.